Hi there, thanks for listening. My name is Dr. Jake Felice, and I have a few patient questions that have been emailed to me that I am looking forward to answering here on this video. First question, what is medical marijuana and how does it differ from recreational marijuana? Well, recreational marijuana does have some medical value because recreational marijuana, or cannabis as I prefer to call it, is usually very high in the molecule THC and very low in other cannabinoid molecules. This type of a profile with a cannabis plant really does have a benefit in the case of nausea and vomiting, appetite stimulation. However, high THC strains such as recreational cannabis that do not have a lot of the other cannabinoid molecules such as CBD, cannabidiol, or CBN, cannabinol, when they lack those compounds, they don't have as much of an effectiveness. For example, we know, and I'll post the links down below, that the THC works synergistically with the CBD so that pain relief from a high CBD plus THC strain is 2 to 4 times that of just a high THC strain or just a high CBD strain. So it's the combination of very low levels of THC with higher, equal or higher levels of CBD that really can provide a lot of pain relief for patients. Next question, is it safe for a person who uses other forms of pain control, such as narcotics, to use medical marijuana? This is a great question, and the answer is absolutely yes, for several reasons. One, the area of our brain in the brainstem that controls our heart and controls our breathing is where opiate medications tend to shut things down and kill people. Literally, we can forget to breathe if we've had too much opiate medication. So the opiates do pose a significant risk to folks, unlike cannabis, which has never killed a single person. So that is one piece of the puzzle. The other piece of the puzzle is that, and I'll attach links to this below, cannabis with high CBDs actually helps augment the use of opiate-based painkillers. That means that the cannabis will help the opiates such as OxyContin, oxycodone, etc. The cannabis helps them work better. And what studies also show is that cannabis in conjunction with opiates usually helps patients reduce their use of opiate medications. There's a real excellent recent article coming out in the Journal of the American Medical Association showing that medical cannabis states have 25% fewer opiate-related deaths than in states where medical cannabis is not an option for folks in chronic pain. So I think that that's a real important thing, and I have, as I said, the links below. Talk about THC and CBDs. Well, I mentioned a bit about it, but one of the reasons that plant medicine can be superior to medicine from single chemical drugs, actually 3 reasons. One is that the positive aspects of the plant medicine can be augmented or enhanced by other chemicals in the plant. The case in cannabis is THC has some beneficial effects such as mild pain relief and some mild anti-inflammatory activity. When we combine the THC with the CBD, we get an even more magnified effect of benefit. The second reason that plants are often superior to single molecule drugs is that the negative side effects of the primary active compounds can be mitigated or reduced by some of the other chemicals in the plant. In the case of cannabis, the negative side effects from THC, such as anxiety, short-term memory loss, and plenty of other mental and emotional symptoms, predisposition to psychosis in a small number of people, these can actually be mitigated with the inclusion of CBD and other plant compounds in the cannabis. So that is another reason why plants can be superior to single molecule drugs. The third reason that plants in general, and cannabis specifically, are superior to single molecule drugs lies in the fact that plants are, as I said, generally less toxic than single molecule drugs. Even over-the-counter drugs such as Tylenol or ibuprofen or even aspirin have high rates of side effects and are associated with a surprisingly large number of deaths. With plant compounds and cannabis specifically, cannabis has never ever a single time been associated with a death by overdose. It's simply the least toxic chemical or the least toxic substance that we have for pain relief that there is. So that's another excellent reason that cannabis can be superior to single molecule drugs, because death is not a side effect. It's just really that simple. And lastly, can medical marijuana help fatigue, muscle spasms, sometimes associated with autoimmune arthritis and other arthritis issues? Absolutely, and don't forget about topical cannabis. Topical cannabis is excellent if you put a lotion on the hands or cream or lotion on the hands. Very good for arthritis of the hands. Works well with knees, works well with neck. The topicals offer a wonderful option that a lot of people don't remember when thinking about cannabis. We think about inhalation, we think about edibles, but remember that the topicals can be very good. Especially for arthritis and muscle spasms. Also, there's a lot of research showing that high CBD strains really do help with the autoimmune process by talking to our immune system and telling the immune system to, hey, tone it down, let's not do this friendly fire attack and be attacking our own cells. In the case of rheumatoid arthritis, autoimmune arthritis, our body's immune system actually attacks the joints and joint capsules, and high CBD strains of cannabis are very, very helpful in reducing and talking to the immune cells and giving the immune cells information that tones down their attack and their inflammatory response. So I hope you found this helpful. These videos are going to be short and unedited, so please excuse that. And if you have any questions about anything cannabis related, I'm going to be doing a series of these videos. You can reach me at drjakefelice.com or at cannabismatrix.com, and you can also just do a Google search for me, find my email address, send me questions. I'm happy to answer. Medical cannabis is a fabulous option for many folks in chronic long-term pain, largely because A, it's effective, and B, it has extremely low toxicity, and C, it helps reduce the use of other more toxic compounds. This is Dr. Jake Felice with Cannabis Matrix. Thank you so much for listening, and have a great day.